Good evening. I need to talk to you about something that happens every single night. Something so simple you probably never think about it. Your sleeping position. Now, I know what you're thinking. How could the way I sleep possibly matter? But here's the truth. After 50, the position you sleep in can have a profound impact on your heart health, your circulation, your breathing, and even your risk of stroke. I've been a cardiologist for over 25 years, and I've seen the connection between sleep position and cardiovascular problems more times than I can count. Let me tell you about a patient I'll call James. He was 67 years old, relatively healthy, took his blood pressure medication regularly, and came in for routine checkups. But James kept complaining about waking up with his heart racing, feeling short of breath in the middle of the night, and experiencing more frequent episodes of acid reflux. When I asked him detailed questions about his sleep habits, he mentioned he always slept on his right side. Had done it for years. It was comfortable, he said. I explained to James that his sleeping position was likely contributing to all of his symptoms. We made some changes, and within 2 weeks, his nighttime heart palpitations decreased dramatically. His breathing improved. His acid reflux episodes became rare, all because he changed the position he slept in. Today, I'm going to tell you exactly which sleeping position you should avoid after 50, why it's problematic for your heart and overall health, and what positions are better for you. This isn't just theory. This is based on cardiovascular research and decades of clinical experience. Comment below, what position do you usually sleep in? On your back, left side, right side, or stomach? Let's start with the position you should avoid. The sleeping position cardiologists want you to avoid after 50 is sleeping on your right side. Now, I can hear some of you saying, but I've slept on my right side my whole life. I'm comfortable that way. I understand. And let me be clear, sleeping on your right side occasionally isn't going to cause a heart attack. But if it's your primary sleeping position night after night, year after year, especially after age 50, it can create problems. Here's why. Reason number 1, it puts mechanical pressure on your heart. Your heart is positioned slightly to the left side of your chest, not in the center like many people think. When you sleep on your right side, your heart has to work against gravity and the weight of your other organs. This positioning can compress the vena cava, the large vein that returns blood from your body to your heart. When this vein is compressed, it reduces blood flow back to the heart, which means your heart has to work harder to pump blood effectively. After 50, your heart isn't as resilient as it was when you were younger. Any additional strain matters more. Reason number 2, it can trigger or worsen heart arrhythmias. Research has shown that right-side sleeping is associated with more frequent episodes of atrial fibrillation, an irregular heartbeat that can increase stroke risk. A study published in the European Journal of Heart Failure found that patients with heart failure experienced more symptoms and worse sleep quality when sleeping on their right side compared to their left side. When you sleep on your right side, you're more likely to experience heart palpitations, irregular heartbeats, a sensation that your heart is racing or fluttering, waking up feeling like your heart is pounding. Reason number 3, it can worsen acid reflux and GERD. This might not seem related to heart health, but stay with me. It is. When you sleep on your right side, stomach acid can more easily flow back into your esophagus due to the anatomy of your stomach and esophagus. Chronic acid reflux doesn't just cause heartburn. It can actually mimic heart attack symptoms, cause sleep disruption, and in some cases, trigger actual heart rhythm problems through a nerve pathway connection between the esophagus and heart. Many people over 50 experience nighttime reflux, and sleeping on the right side makes it significantly worse. Reason number 4, it can affect your breathing, especially if you have sleep apnea. Right-side sleeping can contribute to airway collapse in people with sleep apnea or who are prone to snoring. When your breathing is compromised during sleep, your oxygen levels drop, which puts additional stress on your heart. Sleep apnea is a serious cardiovascular risk factor. It increases your risk of high blood pressure, heart attack, stroke, and irregular heartbeat. Anything that worsens sleep apnea, including sleeping position, needs to be addressed. Let me tell you more about James, the patient I mentioned earlier. James had been sleeping exclusively on his right side for over 30 years. He had mild heart failure that was well controlled with medication, but his symptoms kept getting worse at night. His cardiologist, me, ran all sorts of tests. His medication was correct. His heart function was stable. Everything checked out during the day. But at night, his heart was struggling. He'd wake up gasping for air. His heart would race. He felt anxious and couldn't figure out why. When we discussed his sleeping habits in detail, the pattern became clear. Every single one of his nighttime symptoms occurred while he was sleeping on his right side. I explained the mechanics to him, how right-side sleeping was compressing his vena cava, putting mechanical pressure on his already compromised heart, and making it work harder exactly when it should be resting. James was skeptical. How could something as simple as sleeping position make such a difference? But he agreed to try sleeping on his left side instead. The first few nights were uncomfortable. He'd been sleeping on his right side for so long that his left side felt unnatural. He used pillows to prop himself in position so he wouldn't roll over during the night. Within a week, he noticed a difference. Within 2 weeks, his nighttime symptoms had decreased by about 70%. Within a month, he told me he was sleeping better than he had in years. No more waking up gasping. No more racing heart. No more nighttime anxiety. His wife told me it changed both of their lives. She had been lying awake worried about him every night, and now they both slept peacefully. All because he changed the side he slept on. Comment, right side sleeper. If this is you, I want to know how many of you primarily sleep on your right side. Why does sleeping position matter more after age 50? Great question. Let me explain what changes in your cardiovascular system as you age. Change number 1. Your heart becomes less efficient. As you age, your heart muscle can become slightly stiffer and less elastic. Your heart doesn't pump blood quite as efficiently as it did when you were younger. This means that any additional mechanical stress, like the pressure from sleeping on your right side, has a more significant impact. When you were 30, your heart could easily compensate for suboptimal sleeping positions. At 60 or 70, that compensation is harder and the effects become noticeable. Change number 2. Your blood vessels become stiffer. Your arteries and veins naturally lose some of their elasticity with age. This process, called arteriosclerosis, means your circulatory system is less adaptable. When you compress the vena cava by sleeping on your right side, a younger, more elastic vein can adjust. An older, stiffer vein has more difficulty, which can lead to reduced blood return to the heart. Change number 3. You're more likely to have underlying heart conditions. By age 50, many people have developed some degree of high blood pressure, coronary artery disease, heart valve problems, arrhythmias, heart failure. Even if these conditions are well managed with medication, they make your heart more sensitive to additional stressors, including sleeping position. Change number 4. Sleep quality naturally declines. As we age, we spend less time in deep sleep and wake up more frequently during the night. Poor sleeping position can worsen this age-related sleep disruption, creating a vicious cycle of poor sleep and cardiovascular stress. Change number 5. Medication interactions. Many people over 50 take medications for blood pressure, cholesterol, diabetes, or other conditions. Some of these medications can affect sleep quality, cause nighttime urination, or interact with sleep position in ways that younger people don't experience. For example, diuretics, water pills, can cause nighttime bathroom trips. If you're sleeping on your right side and then getting up multiple times per night, you're combining 2 factors that both stress your cardiovascular system. Let me tell you about another patient. I'll call her Linda. Linda was 72, active, took good care of herself, and had well-controlled high blood pressure. She started experiencing increasingly frequent episodes where she'd wake up in the middle of the night feeling like her heart was beating irregularly. It scared her. She worried she was having heart problems. We ran a complete cardiac workup. Her heart was fine. Her blood pressure medication was working. There was no structural problem with her heart. But she kept having these episodes, always at night, always around 2 or 3 a.m. I asked her to keep a detailed sleep diary for 2 weeks, noting which side she was sleeping on when she woke up with symptoms. The pattern was crystal clear. Every single episode occurred when she was sleeping on her right side. When she happened to be on her left side or back, no symptoms. Linda switched to left side sleeping, and within 3 weeks, the nighttime arrhythmia episodes stopped almost completely. She still gets them occasionally, but only about once a month instead of 3 or 4 times a week. And when she does get them, it's almost always on nights when she's rolled on her right side in her sleep. Type nighttime heart symptoms. If you've experienced irregular heartbeat, palpitations, or breathing problems at night. So if right side sleeping is the position to avoid, what positions are best for your heart and overall health after 50? Let me walk you through the 3 recommended positions and explain the benefits and considerations for each. Position number 1. Sleeping on your left side, the best option. For most people over 50, especially those with any heart concerns, left side sleeping is the optimal position. Here's why left side sleeping is beneficial. Cardiovascular benefits. Your heart is positioned on the left side of your chest. When you sleep on your left side, you're sleeping with your heart, not against it. This position allows gravity to work in your favor. Blood flows more easily through the aorta, your body's main artery, when you're on your left side. The vena cava, which returns blood to your heart, runs along the right side of your spine. When you sleep on your left side, you're not compressing this critical vein, allowing optimal blood return to the heart. Studies have shown that left side sleeping can improve circulation and reduce the workload on your heart during sleep. Digestive benefits. Your stomach and pancreas hang naturally on the left side of your body. Left side sleeping allows stomach acid and digestive juices to flow downward due to gravity, significantly reducing acid reflux. If you suffer from GERD or nighttime heartburn, left side sleeping can be life-changing. Lymphatic drainage. Your body's lymphatic system drains primarily to the left side. Left side sleeping may help with the removal of waste products from your brain and body while you sleep. Reduced snoring and sleep apnea. For many people, left side sleeping helps keep airways open better than other positions, reducing snoring and sleep apnea episodes. How to make left side sleeping comfortable. Place a pillow between your knees to align your spine and reduce pressure on your hips. Use a supportive pillow that keeps your neck aligned with your spine. If you tend to roll onto your right side during sleep, place a body pillow behind you to prevent rolling. Some people find it helpful to sleep on the left edge of the bed, so there's nowhere to roll. Position number 2. Sleeping on your back, second best option. Back sleeping is generally good for your heart and overall health, though it's not ideal for everyone. Benefits of back sleeping. Your weight is evenly distributed with no pressure on any one side of your body. Your spine stays in a neutral position if you use the right pillow. No pressure on your heart from either side. Minimal facial wrinkles and skin pressure, a bonus many people appreciate. Drawbacks and considerations. Back sleeping can worsen sleep apnea and snoring in some people because your tongue can fall backward and partially block your airway. If you have acid reflux, back sleeping can make it worse, especially if you sleep completely flat. Some people with heart failure find back sleeping uncomfortable because it can make breathing more difficult. How to make back sleeping work. Elevate the head of your bed by 6 to 8 inches or use a wedge pillow. This helps with both reflux and breathing. Place a small pillow under your knees to maintain the natural curve of your spine and reduce lower back strain. Don't use a pillow that's too thick. Your neck should be in a neutral position, not bent forward. If you snore or have sleep apnea, back sleeping might not be your best option. Discuss this with your doctor. Position number 3. Semi-reclined position for specific conditions. Some people with certain heart conditions benefit from sleeping in a semi-reclined position, essentially sleeping at an incline of 30 to 45 degrees. Who benefits from this position? People with congestive heart failure who experience shortness of breath when lying flat, a condition called orthopnea. People with severe acid reflux that doesn't respond to left side sleeping. Some people with sleep apnea. People recovering from heart surgery or certain cardiac procedures. How to achieve this position? Use an adjustable bed if possible. Use a wedge pillow designed for sleeping in a reclined position. Prop the head of your bed up on blocks or risers. Make sure it's stable and safe. Sleep in a recliner if that's more comfortable, though this isn't ideal for long-term sleep. Important note about this position. Don't try to achieve this position by stacking multiple regular pillows. This can actually make things worse by bending your body in the wrong places and causing back and neck pain. If you need to sleep semi-reclined, invest in proper equipment designed for this purpose. Let me tell you about Robert. Robert was 75 and had moderate heart failure. He'd been sleeping on his right side his entire life and was experiencing significant shortness of breath at night. His cardiologist, my colleague, recommended he try left side sleeping. Robert tried, but after 50-plus years of right side sleeping, he just couldn't get comfortable enough to fall asleep on his left side. So he compromised. Robert got an adjustable bed and started sleeping in a semi-reclined position, elevated about 30 degrees. This took the pressure off his heart from any side-sleeping position and helped with his breathing difficulties. Within a week, Robert was sleeping through the night for the first time in months. His shortness of breath improved dramatically. After a few months on the adjustable bed, he gradually started incorporating some left-side sleeping, using the elevation plus left-side position for optimal benefit. The point is, there's not always a one-size-fits-all solution. Work with your healthcare provider to find what works best for your specific situation. Comment left side if you're going to try switching to left side sleeping. In addition to avoiding right side sleeping as your primary position, there's one more position that's problematic for most people over 50. Stomach sleeping, the worst position. If right side sleeping is problematic, stomach sleeping is even worse for most people over 50. Why stomach sleeping is harmful? For your neck and spine. When you sleep on your stomach, you have to turn your head to one side to breathe. This puts your neck in an unnatural, twisted position for hours. After 50, this can lead to significant neck pain, stiffness, and even nerve compression. Your spine is also forced into an unnatural arch when you sleep on your stomach, which can cause or worsen lower back pain. For your breathing, stomach sleeping can compress your chest and diaphragm, making it harder to breathe deeply. This means less oxygen during sleep, which stresses your cardiovascular system. For your heart, the pressure on your chest when sleeping on your stomach can affect heart function and blood flow. The challenge with stomach sleeping. Many people who sleep on their stomachs have done so since childhood. It's an incredibly hard habit to break. If you're a lifelong stomach sleeper, transitioning to side or back sleeping will take time and effort. How to transition away from stomach sleeping. Start by sleeping on your side with a body pillow in front of you to hug. This can provide some of the comfort of stomach sleeping. Use pillows strategically to make stomach sleeping uncomfortable. Place them in positions that make it hard to roll onto your stomach. Elevate your upper body slightly, which makes stomach sleeping less appealing. Be patient with yourself. It may take several weeks to break the habit. Let me tell you about Margaret. Margaret was 68 and had slept on her stomach her entire life. She came to see me with complaints of chronic neck pain, morning headaches, and increasingly frequent episodes of waking up with numbness in her arms. Her neck pain had gotten so bad she could barely turn her head to check her blind spot when driving. I explained to Margaret that her sleeping position was causing nerve compression in her neck and contributing to her symptoms. Margaret tried to change positions but kept rolling onto her stomach in her sleep. She'd wake up in the morning on her stomach with terrible neck pain. Finally, she bought a body pillow and several smaller pillows. She arranged them in a way that made it physically difficult to roll onto her stomach. She essentially created a pillow barrier. It was uncomfortable and annoying for the first 2 weeks. She didn't sleep well. She was tempted to give up. But by week 3, she started naturally staying on her side. By week 6, side sleeping felt normal. And by week 8, she occasionally tried sleeping on her stomach out of habit, but found it uncomfortable. Her body had adapted to the healthier position. After 3 months, her neck pain had decreased by about 80%. Her headaches were gone. The numbness in her arms disappeared. Margaret now tells everyone that changing her sleep position was one of the best health decisions she's ever made. Type stomach sleeper if this is you and you want to change. I know what some of you are thinking. This all sounds great, but I've slept the same way for 40, 50, 60 years. How am I supposed to change now? I understand. Changing sleep position is genuinely difficult. But it's absolutely possible, and the health benefits make it worth the effort. Here are my practical, proven strategies for successfully changing your sleep position. Strategy number 1. Use pillows strategically. Body pillows are your best friend. They can support you in a new position, create barriers that prevent rolling to your old position, provide comfort and security in a new position. For transitioning to left side sleeping, place a firm pillow between your knees. Use a body pillow to hug in front of you. Put a pillow behind you to prevent rolling onto your right side or back. For transitioning to back sleeping, use a cervical pillow designed to support your neck properly. Place a pillow under your knees to support your lower back. Put pillows on both sides to prevent rolling to either side. Strategy number 2. Make gradual changes. Don't expect to completely change your sleep position overnight. Week 1 to 2. Start the night in your new position, even if you roll to your old position during sleep. You're training your body. Week 3 to 4. Use pillow barriers to stay in your new position longer. You might wake up when you try to roll, which reinforces the new habit. Week 5 to 6. Your body starts to adapt. The new position becomes more comfortable. Week 7 to 8. The new position starts to feel natural. Month 3. The new position is your default. Strategy number 3. Address underlying comfort issues. Sometimes people sleep in certain positions because of pain or discomfort in other positions. If you can't sleep on your left side because of hip pain, you might need a better mattress, a pillow between your knees, treatment for your hip issue. If you can't sleep on your back because of lower back pain, you might need a pillow under your knees, a different mattress, stretching exercises before bed. Address the root cause rather than just forcing a position change. Strategy number 4. Improve your sleep environment. A good mattress that supports your new sleeping position is crucial. After 50, you might need a different mattress than you had when you were younger. Consider medium firm support for most people, pressure relief for hips and shoulders if you're a side sleeper, adequate support for your spine if you're a back sleeper, an adjustable bed if you need elevation for medical reasons. Strategy number 5. Create a bedtime routine that supports your new position. Do gentle stretches before bed to reduce muscle tension. Practice relaxation techniques in your new sleeping position while still awake. Use your new position for reading or watching TV in bed so your body associates it with comfort. Strategy number 6. Consider a sleep position trainer. Some people find wearable devices helpful. They vibrate gently when you roll onto an undesired position, training you to stay in the correct position without fully waking you up. These can be particularly helpful for breaking lifelong habits. Strategy number 7. Be patient and persistent. Some nights will be better than others. You might have setbacks where you revert to your old position. That's normal and okay. Keep trying. The health benefits of proper sleep position are worth the temporary discomfort of change. Let me tell you about Edward. Edward was 71 and had been a right-side sleeper his entire life. He had mild heart failure and was experiencing worsening nighttime symptoms. I explained to Edward why left-side sleeping would help, and he committed to making the change. Edward bought all the right pillows. He set up his bed perfectly, and the first night, he couldn't fall asleep for 3 hours because the position felt so strange and uncomfortable. The second night, same thing. The third night, he gave up and went back to his right side. I told Edward, I know it's hard, but let's try a different approach. Don't try to sleep on your left side all night. Just start there. When you can't take it anymore, roll to your back or even your right side for a bit. Then try left again. This incremental approach worked. Edward gradually increased the amount of time he could comfortably stay on his left side. Within 6 weeks, he was sleeping on his left side for most of the night. His nighttime symptoms improved significantly, and after 3 months, he told me he actually preferred left side sleeping now. His old right side position felt uncomfortable. Change is possible at any age. It just takes patience and persistence. Let's recap what we've covered today. The sleeping position to avoid after 50. Right side sleeping, especially as your primary position, can put mechanical pressure on your heart, worsen heart arrhythmias, increase acid reflux, and compromise breathing. The best sleeping positions after 50. Number 1. Left side sleeping, optimal for heart health, circulation, digestion, and lymphatic drainage. Number 2. Back sleeping, good for spinal alignment and distributing weight evenly, though not ideal for everyone, especially those with sleep apnea. Number 3. Semi-reclined, beneficial for specific conditions like heart failure or severe acid reflux. The worst position, stomach sleeping, causes neck and back problems, compromises breathing, and puts pressure on your heart. Why this matters more after 50. Your cardiovascular system becomes less efficient and less adaptable with age. The sleeping position that didn't cause problems when you were younger can create significant issues after 50. The good news: changing your sleep position is entirely within your control. You don't need medication. You don't need surgery. You just need the right information, the right tools, pillows, and the persistence to make the change. A final thought. I've been a cardiologist for over 25 years. I've seen thousands of patients with heart conditions ranging from mild to severe. And I can tell you with absolute certainty that the small things matter. The position you sleep in, the foods you eat, the way you manage stress, how much you move during the day. These aren't trivial details. These are the building blocks of cardiovascular health, especially after 50. James, Linda, Robert, Margaret, Edward, all of these patients made simple changes to their sleep position and experienced significant improvements in their health and quality of life. You can too. Now I want to hear from you. Comment below and tell me, what position do you currently sleep in? And are you willing to try changing it? If you found this information valuable, please give this video a thumbs up. It helps more people discover this important information. Subscribe to this channel for more evidence-based advice on protecting your heart health as you age. And share this video with anyone over 50 who might benefit from understanding how sleep position affects cardiovascular health. Your heart works hard for you 24 hours a day, every day of your life. The least you can do is give it the best possible conditions to rest and recover while you sleep. Sleep well, and take care of your heart. I'll see you in the next video.